Hello everyone, this is Matteo Dunnhofer from the University of Udine speaking. In this video, I will present a recap of our paper titled Siam-U-Net, encoder-decoder siamese network for knee cartilage tracking in ultrasound images, which is featured on medical image analysis. The motivation for this work settles in the context of knee arthroscopy. This minimally invasive procedure is performed by inserting cameras and surgical instruments inside knee joints to diagnose and treat disorders of the knee structures. Despite being a common procedure nowadays, this kind of surgery still introduces practical issues for surgeons. Almost 60% of them find the knee arthroscopy challenging to perform, and almost 100% declares that visualizing the knee structures is difficult with current systems. These situations result in the risk of damaging such structures, and the femoral condyle cartilage is considered the one most at risk. Thanks to its advantages over other medical imaging methods, ultrasound imaging is currently being studied to overcome the visualization issues. Coupled with automatic interpretation, ultrasound images could offer guidance to surgeons and robotic surgery during knee arthroscopies. And in those scenarios, developing accurate and robust algorithms is of paramount importance. Thus, for the motivations introduced, the goal of our paper is to develop an algorithm capable of exploiting ultrasound videos to locate accurately and in real time the femoral condyle cartilage. In more details, the problem of interest consists in: given a sequence of 2D ultrasound images and a reference segmentation for the first frame, our tracking algorithm shall produce the segmentation for the other images of the sequence, providing both the position and the shape of the femoral condyle cartilage. To achieve the goal, we propose a new deep learning-based tracking methodology. We consider the Siamese tracking framework, a popular approach in visual object tracking, and the U-Net architecture, the standard neural network architecture for medical image segmentation. And we combine them into a novel deep architecture that we named Siam-U-Net. The network receives in input a target cartilage image and a searching area image where the cartilage is supposed to be present. Through weight sharing, encoder branches and bendings for both images are obtained. Then, the target representation is depth-wise cross-correlated to the representation of the searching area, resulting in an eye-level activation map of the cartilage inside the searching area. The output mask is then constructed by the decoder part, which, through skip connections, refines layer by layer the eye-level activation map and gives as output the segmentation of the target cartilage. Siam-U-Net is then employed to propagate the cartilage node position and shape to subsequent ultrasound slices. At every time step t, target and searching area compute based on the previously known cartilage position and shape. The two image crops are then given to Siam-U-Net that produces the cartilage segmentation inside the searching area, which is then placed in the respective output mask. And the same process is repeated for all the other images of the ultrasound sequence. The ultrasound data necessary for this work, which some specifications are reported here, was obtained by scanning the knees of 6 volunteers. An experienced orthopedic surgeon contoured the cartilage in 80,278 2D images. To train and test our methodology, a cross-validation procedure was implemented, considering the images of 5 volunteers for training and the images of the remaining 1 for testing. The dice similarity coefficient was employed to assess the performance. Here you can have a look at the performance of the proposed methodology in temporal and spatiotemporal tracking setups. Small difference between the two is present, suggesting that the network learned effectively to overcome both inter- and intra-volume variations of the cartilage. Our results are supported by the performance of 2 different U-Net architectures, and also by an evaluation of the consistency of 2 expert operators in segmenting the cartilage. Here, some qualitative results are presented. The reference segmentation drawn by the surgeon is represented in pink, while the output of Siam-U-Net is represented in green. Details about the subject and the leg scanned and the scanning modality are reported below every video. To learn about all the details of our work, click on the link to the paper in the description of the video. Thanks for your attention.